This cream is designed to provide relief for minor aches and pains in the muscles and joints, such as arthritis, backache, and sprains. It contains menthol and methyl salicylate, which are known as counterirritants. These ingredients work by creating a cooling and warming sensation on the skin, which helps distract you from deeper aches and pains in your muscles, joints, and tendons. It's important to note that some products should not be used on children younger than 12 years old without a doctor's advice. If you're using this cream on children between 2 and 12 years old, be sure to carefully check the label before applying it. And remember, it should not be used on children younger than 2 years old. For optimal results, apply the cream to the affected area and gently massage it into the skin. It's recommended to use this cream up to 4 times daily, but be sure to follow the instructions on the label for the best results. And remember, always wash your hands after applying the cream to avoid accidentally getting it in your eyes or on other sensitive areas. As always, speak with your healthcare provider if you have any concerns about using this product. Make sure to follow all the directions on the product package. If you have any questions, consult your doctor or pharmacist. This medication is meant to be used on the skin only. Avoid applying it near the eyes, mouth, nose, or genitals, and be cautious not to touch those areas while the medication is on your hands. If the medication does come into contact with those areas, rinse with plenty of water. Before inserting contact lenses, be sure to wash your hands well. If you are using the lotion, spray, or foam, be sure to shake the bottle well before using. Apply a thin layer of the medication to the affected area no more than 3 to 4 times a day. Gently and thoroughly rub it in. After applying the medication, wash your hands unless you are using it to treat the hands. If treating the hands, wait at least 30 minutes before washing your hands. Avoid applying this medication to injured or irritated skin, such as cuts, scrapes, or sunburns. Do not bandage or tightly wrap the affected area, as this may increase the risk of side effects. You may cover the area loosely to protect clothing. Ask your pharmacist for more details. Heat can increase the risk of side effects. Do not apply this medication immediately before, during, or after activities that increase skin temperature, such as bathing in hot water, swimming, sunbathing, or heavy exercise, or in hot and humid weather. Wait until your skin has cooled before applying the medication. Avoid using a sun lamp, tanning bed, hot water bottle, or heating pad on the treated area. This product comes in different strengths and with different ingredients but with product names that sound similar. Be sure to read the label carefully to ensure you have the right product for you. If you have any questions, ask your pharmacist. Inform your doctor if your condition lasts for more than 7 days, if it gets worse, or if it keeps coming back. If you think you may have a serious medical problem, seek medical help immediately. Some side effects may occur on the application site, such as redness, warmth, stinging, or burning. If these effects persist or worsen, notify your doctor or pharmacist. However, most people using this medication do not experience serious side effects. Stop using the cream and contact your doctor immediately if you experience any serious side effects, including blistering, swelling, severe redness at the application site, increased or unusual pain at the application site, nausea, vomiting, or ringing in the ears. Although rare, a very serious allergic reaction to this drug may occur. Seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching, swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects. If you notice any other effects not listed, contact your doctor or pharmacist. And as always, if you are in the US, you can report any side effects to the FDA, or in Canada, report them to Health Canada. Before using Arthritis Hot Pain Relief Cream, it's important to talk to your doctor or pharmacist if you are allergic to menthol or methyl salicylate, aspirin, or other salicylates. This product may also contain inactive ingredients that can cause allergic reactions, so it's best to consult with your pharmacist for more details. If you have asthma, nasal polyps, or are planning to have surgery, make sure to consult with your doctor or pharmacist before using this product. Additionally, if you are pregnant or planning to become pregnant, it's important to discuss the risks and benefits with your doctor, as this medication may harm an unborn baby and cause problems with normal labor and delivery. For children and teenagers younger than 18 years, it's important to avoid using this product if they have chickenpox, flu, an undiagnosed illness, or have recently received a vaccine, as it may increase the risk of a rare but serious illness called Reye's syndrome. If you are breastfeeding, it's best to consult with your doctor before using this product, as it is unknown if it passes into breast milk. And, as always, it's important to discuss all the products you use, including prescription drugs, non-prescription drugs, and herbal products, with your doctor or dentist before using Arthritis Hot Pain Relief Cream. It's important to be aware of potential drug interactions that may affect how your medications work or increase your risk for serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider before making any changes to your medication routine. If this medicine is swallowed, it may be harmful. If someone has taken too much and is experiencing severe symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call your local poison control center at 1-800-222-1222. For Canadian residents, you can call a provincial poison control center for assistance. Be sure to follow all the instructions on the label. Use this medication only on the skin. Do not apply near the eyes, mouth, nose, or genitals, and be careful not to touch those areas while the medication is still on your hands. If you do get the medication in those areas, flush with plenty of water. Wash your hands after applying the medication unless you are using this medication to treat the hands. If treating the hands, wait at least 30 minutes after applying the medication to wash your hands. Do not bandage or wrap the affected area, and do not use a heating pad on that area. You may cover the area loosely to protect clothing. Wait at least 10 minutes before covering the treated area with clothing. Do not take a bath or shower right before applying this medication. Do not apply this medication before or after activities such as bathing, swimming, sunbathing, or heavy exercise. Do not apply this medication to skin that is injured or irritated, e.g., cut, scraped, sunburned. Do not apply this medication within 1 hour before starting an activity that may cause sweating such as physical exercise or in hot weather. Wait until the skin is completely dry before applying the medication. Do not use a sun lamp/tanning bed, hot water bottle, or heating pad on the treated area. Avoid getting this medication in your eyes. If this occurs, flush with plenty of water. Call your doctor if eye irritation persists. Do not apply the medication on skin that is swollen, bruised, infected, or has open wounds. Do not apply this medication to any area of skin that is affected by eczema or a rash. If you forget to use the cream at the scheduled time, apply it as soon as you remember. However, if it's almost time for your next application, then skip the missed dose and continue with your regular schedule. Do not apply double the amount to make up for the missed dose. When it comes to storing Arthritis Hot Pain Relief Cream, it's important to follow the specific instructions provided on the product package or by your pharmacist. Make sure to keep it out of reach of children and pets. When it comes to disposal, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it's expired or no longer needed. If you're unsure about how to dispose of it, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.